Okay, so this is the timeline that I came up with just to show you how it works when you are working toward getting your license and completing your CF. So you'll notice that at the top we have graduation. Yay! So you'll graduate and you'll start your CF, and then there's a period of time when you're in your CF that will end, and then you are fully credentialed with your CCCs. And then, so there are several things that are going on simultaneously. The other thing that's happening is your praxis. So for the majority of you, you've already taken your praxis. I know that in the other class, almost everyone raised their hand. So the other thing that you need to do is pass your praxis, but you actually don't have to have that score or that passing the praxis has to occur by the end of the CF period. So that's another thing, but you getting that done, so no worries. The other thing is that because you've graduated, we know that you have completed your academic coursework and your clinical practicum requirement. Towson is CAA accredited, and because of the CAA accreditation, ASHA will accept all of the completion of the requirements for certification, which is a form that you'll get from Dr. Fallon. And because we're CAA accredited, it basically says, yes, we're CAA accredited because you've gone through this program. That means that you've met all the academic and clinical practicum requirements to qualify for your Cs. Also, when you graduate from TU, you will eventually get an official transcript. You don't get that when you walk across the stage. That usually takes maybe a few weeks before that will actually come to you. However, you do need to obtain that official transcript, and that is something that you will need to submit a copy of to the licensure board if you're getting a state license. And then that official transcript may also need to be part of your ASHA CF packet. Okay, then this highlighted, there's a verification form that is actually part of your CF, your CCCs, your certification for ASHA. And that form is something that Dr. Fallon will give you, and that will be submitted as part of your certification packet. Okay, now I know there are a lot of moving pieces, and I am going to break this down for you, but before you can really move forward with your ASHA CF and with your state licensure, you need to get a job. So you can't do anything with your CF, you can't do anything with state licensure until you get a job. So what we're looking at here are different scenarios. So one is your ASHA CF. I am assuming that everyone in the class will be working toward getting your ASHA CCC. So you'll be working your clinical fellowship, and by the end of this period, you'll have that. Also, if you're working in a state that requires state licensure during your CF period, then you will also be completing paperwork for state licensure. Those two things are going to be happening simultaneously. Okay? Now, there are some states, not a lot anymore, but there are a few states that do not require a license as you're going through this CF period, or what might be referred to as this interim period between graduation and getting your full CCC from ASHA. Now, if they don't require it in that particular state, I think one of the students told me, for example, Massachusetts is the state that doesn't require it, then you wouldn't follow this second thing. You would just be working on getting your CF packet done. Now, in addition to your ASHA certification, your state licensure, some states have a requirement through their Department of Education. So if you are going to work in a school system, you need to know if that State Department of Education has their own set of credentials that you need to get. So you have to check with the school system. You have to check in your individual state. So in some states, you are not required to have a license if you work in the school system, but the school system itself may have some requirements for taking the praxis and a special credential that you have to have as an educator. That in the state of Maryland, no matter if you work in the school system or in a hospital or in private practice, you have to have a license to practice in Maryland. So you would be fulfilling the requirements for state licensure in Maryland, even during the time when you are working on your CCCs, or as we call that, your clinical fellowship period. Okay, so in some states, what this means, exempt from state licensure, that means that they may tell you, if you're working in the school system, you don't have to have a license, but you may need to have a teaching certificate, or you may need to take an additional praxis. Every state, it has its own authority, so you have to check within that state. Historically, the state departments of education have a lot of clout in each state, and historically, state departments of education could just do whatever they wanted. It was something that in the state of Maryland, this used to be the case also, that you didn't need a license if you worked in the school system. But we fought for it, we lobbied for it, because we thought it was really important to have a license, because that way everyone is under the same standards for licensure. Okay, so let's go back up here. For your ASHA CF, you need to identify a person who will be your mentor / supervisor. That person will be responsible for completing paperwork, which we'll look at later, and that they will agree that they will be your mentor. That's the term that ASHA uses. ASHA uses the term mentor, that they will be your mentor, and that they will be available to contact. They will make connections with you over the CF period. Now, for typical full-time employment, that period will typically be over. You should have completed the requirements in about 9 months. That paperwork will need to be filled out for the state. Now, you will have the same person who is your mentor / supervisor completing paperwork for the state that you're in, as well as filling out the paperwork for ASHA. You will notice that that paperwork may be very similar. It may look exactly the same. There may be some slight differences, but this person is agreeing to be your mentor / supervisor for this period of time. The reason that I say mentor / supervisor is that because depending on the state, they may be using the term supervisor. It's not the same as when you were a student. You don't have that same level of supervision, but this person is vouching for you. In the state of Maryland, when you get your, it's called limited license in Maryland, you don't actually get your own license number during this period. You have a limited license under the name and the license number of the person who is your supervisor. So they are really taking on a big responsibility. Okay? So you're going to have those forms signed. Now, in the state of Maryland and most states, this paperwork is turned in as soon as it's signed. In the state of Maryland, you cannot treat a client, a patient, you can't have contact with the clients or patients until you have been approved for your limited license. Some states have a grace period, which you may have seen. They may give you a certain amount of time to have that paperwork completed, but it doesn't prevent you from having contact with the clients or patients. In Maryland, that's not true. You have to have that approval before you actually are working with the client or patient. Now, what some employers will do is they'll use that as an orientation time. So maybe you'll start your work and you'll go through your orientation and trainings that you need for that job, but you have to have that approval before you can actually start practice in the state of Maryland. You will also, as I said, have paperwork that your supervisor who is over you for the limited licensure will complete that paperwork going forward. Now, you're turning in paperwork if the state, most states require that at the beginning of this period. Maryland definitely requires it. You, by law, cannot see anyone until it's turned in. So at the end of the review period, then you're also turning in your paperwork to the state to convert to full license. Maryland calls it a limited license, some call it a temporary license, but you are going to be finishing it, and then you'll have a full license with your own name and number, not under the supervision of another person. So at the same time you're completing your paperwork for ASHA, you're completing your paperwork for the state. ASHA can take up to 6 weeks to process your CCCs. The states are typically faster. I know that in Maryland it's usually pretty timely. For one thing, they already have all of your information. Remember, for ASHA, you're not turning everything in until the end of that period. Okay, so as I said, if there's no licensure requirement during the CF in that particular state, then you're going to just do everything that you need to do for ASHA. And then if this state says in order to have a full license, they are typically wanting you to turn in paperwork saying that you have completed a CF, and then you will be able to apply for a license. Or they may say, we need to see that you've achieved your Cs, for example, in order to get your license. Again, you have to check with your state, and they're very specific about that. So, a couple of questions that came up. Can you have more than one supervisor? Like, can you have a part-time position? Yes. So the requirements say that for ASHA, and I think for the state of Maryland, I believe it's the same, that you have to work more than 5 hours a week in order for it to count toward your certification, your hours or time, which makes sense. Like, if you're only working 2 or 3 hours a week, then that's just not really working a job. So you have to be working at least more than 5 hours a week. If you're working 10 hours a week, it's going to take you a really long time to finish. So then it's prorated, and I'll show you something that shows sort of a time frame in terms of how many hours a week you're working and how long it would take you to complete. So when you get your temporary license in Maryland, that gives you 12 months in order to complete your CF. If something happens and you don't finish in time, then you could have that, you can reapply and get that extended for another year. Some students said that there are some other states where that limited license or temporary license that's for the purpose of this CF period, some states actually issue that for an 18-month period. So you want to be familiar with what the time frame is in your particular state. Okay, let's see. All right, so let's say you have 2 part-time supervisors, and each one is supervising you about 15 to 20 hours per week. That's fine, but each one of those supervisors will need to fill out the paperwork to document that you are meeting the standards for ASHA, and the same thing has to happen for the state. So specifically, state of Maryland, you're working in 2 locations. You would have a limited license that will have the name of the person and the place that you're working in your file for your state license. I wouldn't recommend going past 2. I think it gets really tricky, and hopefully you can have 1 full-time job and, if necessary, 2 part-time jobs. Again, you won't be able to fill in any of that paperwork until you have a job. So get a job, and then you can begin that process. Now, one thing that may have come up as you were looking at the state license reviews was continuing education. So for ASHA, you are not required to have continuing education during the CF period. That CEU tracking, the continuing education tracking, will not start until you begin your CCC. So once you finish your CF and you get your CCCs, then it will start tracking, and you'll have 3 years to accumulate 30 continuing education units. In the state of Maryland, you don't have to start tracking your continuing or accumulating continuing education units until you complete your limited license and have your full license. In the state of Maryland, you have to have 30 CEUs accumulated in 2 years. So for me, because I'm licensed in Maryland, then I always have more than enough for ASHA. You're not getting separate CEUs. So whatever CEUs count for your state license can also count for ASHA. You just have to make sure that that they are approved continuing education units. It can't just be anything. Let's see. And I do know that there's at least one state, and that is South Carolina, where they do ask you to complete, or you are required to complete, some continuing education units during this CF period. And I believe that it's 8 hours, but again, if you are interested in being licensed in South Carolina, that's one thing that you'd want to double check. Also, again, every state has its own jurisdiction, its own authority. So you really have to make sure you're following whatever the process is in that particular state.